We're talking health. We're talking how to stay healthy with Dr. Zach Levine, who is an ER physician at the MUHC. We're talking about staying healthy in your 20s and 30s, or trying to stay healthy in your 20s and 30s so that you're not decrepit by the time you hit 40. Dr. Zach, thank you so much for joining us this morning.
Thanks. It's great to be here.
It's very exciting to be here. We want to remind people that you will be back to talk about your 40s and 50s. We're going to go, full circle on this. Yeah. 20s and 30s, in general, people are supposed to be in good shape, but maybe we're not thinking about, we think we're going to forever young, nothing can affect us. Yeah. What are some of the issues we should be keeping front and center, even in our 20s?
Well, like you said, the 20s and 30s are a very healthy time for most people. Obviously, we see there are exceptions, but the 20s and 30s are the time when you should really start to think about your health. That's the problem. Most of us don't, right? In our 20s and 30s, we're just enjoying ourselves. We think
partying.
Yeah, exactly.
Yeah.
So that's the time when you should start to think about things like, well, number one, we were talking about finding a doctor, because it takes a long time.
Well, that's why we were giggling when the camera came back, just because it is nearly impossible. I mean, it's very difficult. And as a doctor, I think you can
absolutely. I work in the emergency department, and the majority of people, I say at the end, okay, do you have someone to follow up with? Do you have a family doctor? No. So, so that we try and arrange some kind of follow-up for them. But if you start early, so that's the thing, it can take a few years for sure, but if you start thinking about it when you're healthy, the wrong time to start thinking about it is when you're sick, right? When you're 65 and you're sick, and then you get on a list that takes, whatever, 2 or 3 years.
So if you start looking in your 20s, you should get one by the time you're 65. Is that what you're saying? I mean, it's a long process, right? Yeah. But if you don't have a GP, what are certain things that you should be maybe looking at or changing in your behavior in your 20s and 30s? Like things to avoid. Obviously, there's some big ones.
Yeah, and like you guys were saying, people know them. I'm not going to say anything that's revolutionary, I mean, we know we shouldn't smoke. It's the time to start, Woody Allen had a really good line, is that you can live to 100 if you give up everything that makes you want to live to 100, right?
No.
You don't have to do that, though,
so
right?
So depressing.
You don't have to do that. You can still, do some things you enjoy, eat some junk, whatever, but start thinking about it, right? Like most of the time, eat the good fats, which are like the fats in nuts and fish. Most of the time, eat, if you're eating bread, have brown bread, brown rice, brown pasta.
Darker colors.
Exactly. Those are better for you. Start exercising. The problem is, a lot of people have desk jobs, and so it's hard not to start putting on the pounds, but it gets harder and harder to keep them off. And also, if you start to gain a lot of weight in your 20s, it becomes harder and harder to get it off and become a slim person in your 50s.
So question, if you have the extra pounds in your 20s, is that a sign that that's going to stay with you?
It's certainly, in general, yes, unfortunately. I mean, it certainly puts you more at risk at being obese or overweight when you're older. Obviously, it doesn't mean necessarily it's going to be the case. But if you start to put on the pounds, it's a time to say, holy, pay attention. It's time to change the lifestyle, because, you need to get into a bit of a rhythm, a bit of a lifestyle. And if you can make healthy choices when you're eating, when you're getting to work, for example, if you can get to work other ways aside from driving, if you can take the stairs at work, if you can make those kind of choices. And of course, I have to say, stop smoking.
The obvious one, stop smoking. And in terms of drinking, because the 20s and 30s are, they're a time where people like to indulge, right? Because you can stay up till whatever time and then go to work the next day, whereas as soon as you hit 30, you're like, oh my God. But so how, is there like a directive? I know that for the amount of alcohol that women and men drink is also very different.
Yes.
So women should drink a little less?
Yeah, I mean, the general recommendation is that women shouldn't have more than an average of 1 drink a day.
Okay.
And men an average of 2 drinks a day. The problem is most young people binge drink, right? So they don't just have, they'll have no drinks all week, and then whatever, Thursday, Friday, Saturday nights, they'll have 20 drinks, which is
that's a false equivalency. Everyone says, well, I didn't drink all week, so I can drink. That doesn't work.
And that's a big load, right?
Yeah.
And there's those studies that were quoted a few years ago that say that moderate drinking is pretty good for you, especially with red wine. And that's true, but that's only if you're regularly moderately drinking. So 1 glass of wine at dinner. Drinking 20 drinks is never good for you, right? At any age.
We can make that statement official now. Drinking
Absolutely,
20 drinks is not
bad
great.
For you.
In terms of shots, vaccines, I know we're talking about hepatitis. Which ones should we be keeping up in our 20s and 30s?
I mean, I certainly recommend the flu shot.
Okay.
I certainly get it every year. I'm sure.
Well, you work in a hospital too, so it's kind of necessary.
Yeah. So, but I think people should get it, definitely if you're older, if you have chronic disease, those people should definitely get it. There's tetanus. You should get your tetanus. Whenever someone comes in with a cut or an injury, we recommend that they get their tetanus shot renewed every 10 years at least, or every 5 years if it's a really dirty cut. And then hepatitis depends what you do. So Hep B is something that you should get renewed. You can actually get tested for your titers to see if you're up to date and you're immune to it. Hep A is recommended, especially for travel, because that's the one that tends to be caught when you're traveling and when you eat contaminated foods.
So basically just make sure that all of your vaccines are up to date. And just really quickly, because we run out of time, if you have messed up your 20s and 30s, is it too late?
It's never too late.
Okay.
Absolutely.
So that's why you're coming back next week. So if you have messed up your 20s and 30s, you can catch up in your 40s. Dr. Zach will be joining us shortly, or soon I should say, to tell us how to recover. If, maybe say you haven't made the best choices. Thank you so much for joining us.
Pleasure. Thank you.
All right, stay tuned.